If you have knee pain, it can feel like it's just something you have to live with, right? Well, I'm here to tell you that you have way more power over your knee health than you might think. So today, we're going to lay out a clear roadmap to help you take back control.
So, does this sound familiar? That kind of stiff, achy feeling when you get up from a chair? Or maybe it's that twinge you get going up the stairs? Or just finding it harder to get down on the floor to play with the grandkids? If you're nodding along, you are so not alone. But here's the thing, that discomfort, it absolutely does not have to be your new normal.
Okay, let's just pause on this for a second because this is probably the single most important idea we're going to cover. It's a simple little phrase, but it can completely change how you think about your knees. Movement isn't the bad guy here. It's actually the solution. So here's our game plan. First, we're going to understand what's really going on inside the knee. Then we'll build a solid foundation with lifestyle changes, add the absolute key ingredient, exercise, and then talk about how to handle those inevitable bad days. After that, we'll look at some other tools in your toolkit, and finally, we'll put you right where you belong, in the driver's seat. All right, first things first. Let's get on the same page about what knee arthritis actually is, because honestly, the way we think about it has totally changed. For years, and I mean years, the thinking was that arthritis was just simple wear and tear, like an old car tire that just gets worn out and there's nothing you can do about it. But here's the really exciting part. We now know that's just the wrong way to look at it. A much better analogy? Think of your knee like a plant. With the right care, the right nutrients, it can actually grow stronger and healthier. It's a living thing. So what is osteoarthritis from a technical standpoint? Well, it's what happens when the cartilage, that's the smooth, natural padding on the ends of your bones, starts to wear away. And yeah, for a lot of people, it's a normal part of aging. But the crucial point, the thing I really want you to take away, is that the symptoms, the pain, the stiffness, are absolutely manageable. And you might feel this in different ways. It could be a sharp pain or maybe more of a constant dull ache. That morning stiffness is a big one for a lot of folks. Sometimes you'll even see some swelling or feel heat around the joint. And these things can come and go. You'll have good days and you'll have bad days, and that's totally normal. Okay, so if any of that is sounding familiar, where do you even start? We start with the foundation. These are the powerful lifestyle changes that can make a massive, massive difference. Now, this is really interesting. When we talk about weight, it's not a one-to-one ratio. Every extra pound on your body is actually magnified by your joints. Think about that. 2 to 3 times your body weight going through your knees just on the stairs. So it makes sense that losing even a little bit of weight can dramatically reduce that load and lead to a huge reduction in pain. And food, of course, plays a big role too. Certain foods can actually dial up the inflammation in your body, which can make your arthritis symptoms feel a lot worse. In general, just trying to avoid things like too much alcohol, sugar, and those highly processed foods is a fantastic strategy, not just for your knees, but for your overall health. All right, we've built our foundation with diet and weight. Now it's time to add the single most powerful tool we have for fighting knee pain, and that is exercise. I absolutely love this analogy because it just perfectly captures what's going on inside your knee. That stiffness you feel, it's not damage. It's just like honey that's been sitting in the cupboard. Movement literally warms up the natural fluid in your joint, making it smooth and slick again, so everything can just glide the way it's supposed to. So what's the goal here? Well, the research points to about 150 minutes of moderate activity a week. Now, before that number freaks you out, remember, you can break that up any way you want. It could be 30 minutes, 5 days a week. It could even be 10-minute bursts here and there. The only thing that matters is consistency. Okay, let's look at a really good, simple move. This one targets your quadriceps. That's the big muscle on the front of your thigh, which acts like a major shock absorber for your knee. The key here is just slow, controlled pressure. Really think about pressing the back of your knee down and flattening that towel. Hold it, and then slowly release. The muscles in the front are crucial, for sure, but so are the ones in the back. This glute bridge is fantastic for strengthening your hamstrings and your glutes, which provides so much stability for your knee joint. Just remember to give those glutes a good squeeze at the top of the movement. Now look, even with the best plan in the world, you are going to have bad days. Flares are just a normal part of living with osteoarthritis. The key is not to panic, but to have a calm, step-by-step plan to manage them when they happen. So think of it like a ladder. You always start on the lowest rung that works. First, try something you can put right on the knee, like an anti-inflammatory gel. If that's not cutting it, then you can move up the ladder. But remember, the stronger stuff is really just for short-term use during a bad flare-up, not for every single day. And please never underestimate the power of the basics. Pain and swelling can actually shut down your muscles and stop them from working right. A simple ice pack for 10 minutes with your leg propped up can calm things down so much and get those muscles firing properly again. It's easy and it really works. Okay, so you've got a handle on lifestyle, exercise, and managing those flares. But what if you need a little more support? Let's talk about some other fantastic non-surgical tools you have available.
And the brilliant thing here is that you don't have to do this all by yourself. A walking stick can take a ton of stress off your knee. Good, supportive shoes are your foundation. A simple brace can give you stability and confidence. And of course, a physiotherapist can create a personalized exercise plan that's just right for you.
Injections can also be a really helpful tool. Think of it this way. A corticosteroid shot is like a powerful firefighter putting out a major flare-up of inflammation. Hyaluronic acid, on the other hand, is more like an oil change for your knee. It helps lubricate the joint. They both have their place, and it's definitely a conversation to have with your doctor. Which brings us to our final and honestly our most important point. All of these things we've talked about, from diet to exercise to injections, they're all just tools, and you are the one in charge of the project. I really want you to hear this. This is a quote from a surgeon. Even the folks who do knee replacements for a living would much rather see you succeed with all these other options first. Their goal is exactly the same as yours, to get you back to the quality of life you want and deserve. So there you have it, the roadmap to taking control of your knee arthritis. It's not about some magic cure. It's about small, consistent, smart choices that add up over time. The power is truly in your hands. So the only real question left is, what's your first step going to be?